Ahoy, this is David Perry with my continuing series of interviews with friends and colleagues around the world, talking about how we get from what I call the great pause into the great return. And today, I'm very happy to have in the Zoom room someone who has been dealing with, well, the mental health aspects of COVID-19. Please welcome to the Zoom room, Dr. Bernadette Grosjean. Welcome.
Thank you so much, David.
Well, and you and your lovely wife have the honor, or I guess I should say the distinction, of being my first couple interview one-on-one. So I found when I was speaking to your wife, Christine Burrell, about her work, your work also interesting. What a lively household conversation you must have around dinner time. Talk to me about your work in general as a psychiatrist, but then I want to talk to you specifically about how COVID-19 has impacted your work and who your very specialized client base is, in a way.
So I'm a psychiatrist. I've been a psychiatrist for 30 years. I was trained and worked initially in Belgium and was trained in different aspects of psychiatry, psychotherapy. I was in psychoanalysis for many years, and of course, pharmacotherapy too. For following my heart, I moved to the United States in '99, so I had to redo my psychiatric residency. I worked at Harbor UCLA, which is a big county hospital in Los Angeles. Worked there for 16 years as a faculty, working a lot with homeless population, an underserved population, and in many different aspects. There are people, we imagine, homeless affected by multiple problems, psychiatric problem, addiction, and so forth. I left that in 2016 and continue. I was working all along with another nonprofit called SSG, also working with underserved population, poor people who couldn't offer psychiatry, refugee, victim of domestic violence, victim of torture. So I'm still working there, it's part-time. But then when COVID happens, I'm one privileged person. I was able, and I am able, to continue that work on telepsychiatry. So I work with teams, and we're able to wonderfully keep treating patients who are in the street, who are in difficulties. We're able to see them, all that computerization of medicine that a lot of us, including myself, are complaining about. It's actually incredible. Who knew that we would have this pandemic and that I could continue to offer treatment, because a lot of patients, if they don't get their medications, if they don't have a follow-up, will just fall back in psychosis and in the street. So that's one big part of my work. And then in March, mid-March, when the pandemic was really, New York was suffering, we were losing so many people. One of my colleagues, Dr. Mona Massoud, who is a colleague psychiatrist on the East Coast, wrote, and we have Facebook groups for physicians, for women physicians actually. And she asked if anybody want to help to build a helpline for physicians in the front line. We were aware, of course, that it was horrible at so many levels for all health workers, but also for physicians. And we kind of knew, probably because we're physicians ourselves, how hard it is for physicians to ask for help, to even realize they need help. And we thought it would be important to offer support from psychiatrists, who are also physicians, because a lot of what was happening in the front line in terms of medical terms, we could have a better sense ourselves, having gone through that. We also want to help medical student, resident, and it's a journey we did. So Mona asked for support, and in a couple of weeks, she got Smita, who offered to help with the administration, a colleague who had worked, Dr. Fu Sheng, who had worked in China, helping first frontline worker there with texting, offer his help. Another, Alison, offered to build a website, and we have 200-300 psychiatrists volunteering. So it took just a week, and we start that line, which is called a physician helpline. We'll say the number again at the end, but I have here the phone number. It's 1-888-409-0141, physician helpline. We'll say that again at the end. And what is beautiful is that we have psychiatrists from all over the country. helping physicians, medical students, residents from all over the country. Because there are multiple reasons why doctors have difficulties asking for help. They're the way we're trained, but also the fear that if you have support, if you see a psychiatrist, a psychotherapist, you have to report it to many boards in the US and may compromise your license, your renewal of your license. You may want to speak to someone in another state because you may not want necessarily for confidentiality, obviously reason, speak to someone who is in the same state, in the same hospital, or who knows. So this aspect of confidentiality and multiple states all together is also very important. And since then, we had many calls. We may ask more about that, but that's what we started. And it's quite wonderful and extremely necessary at this time.
So, I mean, I'll ask you a big question, but it's the overall question. Well, I'll start by telling a short story. Yes, last night my husband and I had a friend over for a socially distant dinner, someone we hadn't seen in 6 months, and he's been living alone. And we asked him how he was, and he said, I was so glad to hear Michelle Obama talk about depression and how this epidemic is impacting people, especially if you live alone. And it was very difficult for him. It was very emotional for him being here. We were the first people he had seen in 6 months. So my big question is, how bad a mental health crisis has been caused by COVID, and how long are we going to live with that? The mental health implications of this.
And we can speak about at different levels, right? At the general population, of course, there is so many trauma happening now, and as all trauma, in general, we only perceive the consequences, or sometimes only perceive their existence months and years later. Mm-hmm. So there are a lot of the isolation. I remember a patient telling me, suddenly realized he was living alone for months, that he was in a store and he was speaking to the cashier and realized he was just talking to himself. And he is not a psychotic patient at all, right? So the effect of isolation, of depression, the effect at the general level of the population of all the people who will be inadvertently transmit COVID to a loved one, and that loved one may die, or maybe because it's not only that COVID provoked, the long-term consequence, and we're discovering that only now, at a neurological level, at a cardiac level, at an autoimmune level, we realize, and I'm also on the COVID-19 for physician side, and a lot of these physicians have been sick with COVID, and so many have long-term consequences of that. So you have that other aspect, right? I often, when I see people, not wearing masks and say, well, that doesn't exist. And I know that some will kill a loved one, not knowing really because of all the political atmosphere. And I see these people will forever keep that guilt. So that's another aspect we're going to have to look at. Now, at the level of healthcare professionals, it's the trauma is gigantic at so many levels. The lack of protection, working fearing for your life, the fearing for bringing home COVID. And I know of some nurses bringing COVID to her husband who was diabetic and died. I mean, you have all this trauma. You have the powerlessness of being unable to save patients, because some ICU doc said that majority of patients in ICU patients will die after 3 weeks, 4 weeks, 6 weeks, but so many die, and question that sense as a physician that you have to save people. You have in certain circumstances, and I fear we're going back there, you will have to make choices, ethical choices, which are breaking, of course, and which is create these moral injuries when you have to make choices against the reason why you went into medicine and medical school.
So you talked to me about how some physicians are loath to ask for help, some because of, I don't want to say ego, but they feel like I should be able to take care of this, but also they might have to report it to boards and whatnot. So in a sense, has the work you've been doing been kind of like a priest in a medieval confession? It's like the seal of the confessional. is what you're doing. I mean, do they, in a sense, talk to you in the closet because they don't want anyone else to know that they're seeking psychiatric help?
It's part of that, but I would say the level to which physicians are blind to their own suffering and pain is incredible. Almost all callers apologize for calling us. We have a considerable number who they are calling us, say, well, I just want to check you exist and I want to give you a number for a friend, and then end up talking.
Yes.
But I think themselves not being aware that which is devastating for me and for my colleagues, we are working on this helpline, is how we don't take care of our physicians. We want them to take care of them. We train them for that. And we are trained, and I did my training two continents the same. It is kind of macho things, right? You want to go help. You want to tell people they need to take care of themselves. And this entire training, the competitiveness and the loneliness in which we arrive, we're not a team. We should work as a team. We should help, the people who are in difficulties and don't know. And we have this incredible competitiveness. We have now the price that students pay to become a doctor, hundreds of thousands of dollars, right? So even if after a while you feel it's overwhelming, you cannot ask for help. You worry to be reported to the board. You worry the attending is going to think you're a weak person. And so you put down this, insight that maybe I need help. And with time, you forget that you may need help. And then a lot of physicians, may self-medicated by medication, by alcohol, by drugs. And it's kind of a spiral in that way. And it's dramatic. Physicians have the highest, before COVID, physicians have the highest level of suicide of all professions. We lose between 400 and 600 doctors that we know of every year to suicide.
How many?
400 to 600. 1 million patients lose their doctor every year to suicide. And suicide is much higher for women. Women physicians have it's like 5 or 10 times the level of suicide in the population. So what we discovered, and we plan to continue that helpline after COVID, is its incredible need to change the way things are organized for doctors. There's a big work is done at the level of the board to change this requirement. Of course, the boards are there to protect population, and we want the patients to be protected. But as we know, if a doctor doesn't speak about their problem and self-medicate with alcohol, it's not going to help the patient. So we really try to have a language who is asking the doctor if they are currently impaired. The many states, and still now, are, have you ever been impaired? And have you ever been seeing a psychiatrist? And if you say yes, you give access to all you charts, all you know.
So we forced our caregivers to lie to give better care.
To lie or not to seek help.
Yes.
Not to seek help. And that's one of the reasons where you have so many suicides. And you really realize, to go at the beginning of the question, how doctors even forget that they can need help. And what we discover with the line is one big part of our work is that they authorize themselves to identify a problem, and that's okay to ask for help.
In our last few minutes, talk to me about one particular story that has stood out for you. I mean, obviously with confidentiality. During this period, a case or a call that moved you or has impacted you that you'll never forget, this, a particular call or a particular case?
Of course, for confidentiality, I cannot give it specifics, but I can make
yes.
a mix of what the help. And I would start with typical someone calling for a friend, and doing that in between the clinic and the home, because I saw so many physicians, they don't want to bring home their pain. So many are maybe the head of a ICU, the head of a internal medicine infectious disease. So they have to be the person who is strong and solid. And then when they're home, they have the kids and we need to help, and it's the school and then sometimes the husband who is a doctor lost their job because they are an ophthalmologist and the clinic is closed and we have $100,000 in debt and we maybe foreclose the home. So the infectiologist has to work. And so we'll call in between work and home at 10 p.m., wherever in the States it is. I'm in California, so I take a lot of late calls. And start speaking about the basics. I mean, it's the death, it's the people we cannot save, it's our fear of getting COVID, it's our fear giving to the family. And I would say what's typical is that doctors are humans like everybody else. They have the kids to take care. They're terrified to give COVID to the kids. And I can say one example of one person who was sick with COVID, and the wife gave birth during the time of the husband who was sick with COVID, and he couldn't see baby, and the couple didn't know if they would meet again because the husband was in an ICU, and of course the mom couldn't go, the mom to be, right? So you have to, they have life like everybody else. They just don't have support. They cannot speak to their colleagues. There is no time. All these people dying in ICU, there is no time for a debriefing to speak about that. Or colleagues who just died in the ICU, and the nurse and the doctor knew it's a friend, it's 30 years old. There's no place to talk about that, no place to share.
Sometimes
it's just that what breaks my heart is that loneliness, that isolation of our heroes.
Yeah. Sometimes I imagine for them, just talking about it is therapy.
I think calling, it's been always the case. When you give your first call to a therapist, you already did the most difficult steps. It's very difficult. You have to be very brave to do that. And just calling us, I think it is. And then hopefully what we do is really authorize the person to recognize they're humans. Mona created that hashtag, human before heroes. And that the physician is able to recognize that is so fundamental and so difficult.
In closing, is there any advice you would like to give to our heroes, specifically physicians who you're treating, about how to get through this period and what to do?
It's very hard. I think if things are difficult, don't keep it for yourself. Find a place to share. It's always a way to share with us. We're there, from 8 a.m. to 1 a.m. East Coast, but maybe a friend, maybe a family, but don't keep it all for yourself. You don't want to die as a hero. So you want to live and be living as a, imperfect person, because we are all, but stay alive. Take care of yourself. Do for yourself what you would tell a friend or a patient to do for themselves.
So show us the phone number one more time, and I will also include it in the write-up for the article.
Here's the physician support line.
1-888-409-0141. Dr. Grosjean, thank you for your time. Thank you for your work. Hopefully on the other side of this, we'll talk about how we are getting from this great pause into the great return. Thank you so much.
Thank you so much, David. Thank you for our heroes.